everybody, welcome back to my channel. Today is Tuesday, April 21st. I wanted to come on here because I'm going to start to document at least one or all of my health issues. I don't know how exactly I want to do it. As you know, last Monday on the 12th, I had a surgical procedure done, which included 2 epidural sterile injections. And the doctor had told me to take a few days to rest, which I did. And then to kind of get back to normality, like do my normal things, don't over exaggerate it, but to do my normal things. And so I started to do that little by little. I watched my granddaughter. I had some help, but I did pick her up like once or twice, trying to be very careful. But I shouldn't have did it either. And last night I was just cleaning the kitchen before I watch some TV and then ultimately go to bed. So I was cleaning the counters, I was throwing away all the stuff, I washed the dishes, I made my husband's lunch, I swept, I mopped, I threw away the recycling and the garbage. Felt good, still trying to be careful, not really go crazy. And my daughter was kind of helping me a little bit. And I thought, okay, I'm going to wash my face, brush my teeth, sit down, watch some TV for a little bit, and then I'll take my shower and go to bed like I normally do. This lighting is the most horrific lighting ever. I'm so sorry. Let me see if I could shut it down a little bit. So yeah, I did that. I brushed my teeth and I was washing my face in the basin. All of a sudden, I got the most hugest, deepest, sharpest pain, like a knife pain. And I've never been stabbed, so I don't know how I can even compare stabbing, but it seems to be the one example that I use. I guess I imagine that's how stabbing would be. Went straight down from the middle of my back to the right side, which is where I'm having problems at, down my leg, and dropped me to my knees, dropped me to the ground. I could barely breathe. I couldn't move. I knew something went horribly wrong, that this pain wasn't going away, and that I would no longer be able to walk or use the bathroom or do anything without help. So I called my daughter, thank God, after like 3 calls because the door was shut because I didn't expect that to happen. She heard me and she came and picked me up. And, or not pick me up because I kind of picked myself up and put myself on the toilet and just didn't want to get up from there. And so she kind of came in and she helped me and I told her what had happened. And she's like, oh my God. She goes, maybe you started going back to normal too fast. And I said, well, that's the instructions he gave me. But maybe so. Maybe my body it just isn't ready. And I like a clean house. I like it clean throughout the day. I like it clean when I wake up. I like it clean before I go to bed. I mean, it doesn't have to be perfect, but pretty fresh and clean. Almost perfect in my way of being perfect, pretty much, I guess. But yeah, and she helped me to get in the shower because I cannot sleep without taking a shower. I just can't. I can't. So I just scuffled through my pain, and she was there to catch me, and I got through it, and she got me in the bed. She got my water, which I like to have a water jug at night by my bed full of ice. Love to drink water. And yeah, so I didn't want for her to call my husband because he had told me earlier he had seen me cleaning. He goes, you need to stop. I'm like, but the doctor told me to get back to normal. I'm just doing normal stuff. And he goes, it's weird. I just got a call that I didn't recognize. But anyway, so I didn't want to tell my husband because he had just told me that. And I'm like, he's going to say, see, I told you you weren't ready. So, but somehow in the middle of the night, I couldn't turn. And I had to go to the bathroom again. I was just in so much pain. And he heard me like moan and stuff. And he's like, what's going on? Are you okay? And I ended up telling him what happened. And I thought, oh my God, I, I don't know what happened. This is the most scariest thing. So that was the pharmacy. I didn't recognize the number. And I don't answer calls if I don't recognize the number. It gets so much spam. Oh, it's incredible. And I feel like if it's really for me and it's important, the person will leave a message. So, but yeah, so the whole night I didn't sleep. I didn't sleep the whole night because I wanted to turn and it took every strength I had to turn. And then I had to stay in that position as long as I could. And then I had to use the bathroom. I'm always in the bathroom because I drink so much water. So it was a rough night. So I couldn't wait for the doctor's office to open to call. He said if I ever got severe pain or something ever happened, to call him and he would see me right away. So they told me, okay, come in at 3:45. And I said, okay. So then just knowing that I would be able to see him, which he is an amazing doctor. He's my pain management doctor. He's done all my surgical procedures. He was so anyway, I don't even remember where I left off at, because the pharmacy and my husband were calling me all at the same time. They had questions on medications. So anyway, so yeah, so I couldn't wait, but I was relieved that I got the 3:45 appointment. I knew he wouldn't let me down. He's the best of the best, the most amazing doctor. In fact, the three doctors that I have in my life, my primary care, my women care doctor, and pain management doctor, I am truly, truly, truly best. They really deeply care about me. They know my life and my record so well, and they go above and beyond to take care of me and answer all my I mean, you couldn't ask for better. I have angels on my side. So I knew I would get an appointment at least. I was hoping because I thought he's even if he doesn't have a space, he'll make a space. And so yeah, so I got the 3:45 appointment, and then my daughter helped me to take a shower because I have to shower in the morning. I just can't. And you always want to be fresh and clean when you go to the doctor's. Well, not that they were gonna really check anything down there, but you just want to be, presentable, and you just want to be very hygienic person, very clean. So that's just me. So she helped me, and then I didn't put no makeup on that, so I don't have no makeup on. I just put on the most comfortable clothes I could where it was stretchy, and when I came home I could just continue to relax in them, and stuff like that. So yeah, so I went to the doctor. My husband took me, and he did a couple of different manual tests on me. He went back to look at the last MRI that was done, which was, I believe, the beginning of this year, and that's why he did the surgical procedure. So he said, yeah, we're gonna need a new MRI. He said it wasn't nothing that you did. He said, what exactly that you did before this happened? So I told him. He said, okay, you didn't lift anything heavy. And I said, no, especially not that day. I didn't lift anything heavy. But the day before, like I said, I had picked up my granddaughter. She's only one, but she's hefty. She's skinny though. But babies can be heavy, and with my condition, it feels even heavier. So I don't know if that kind of led to it, and then the cleaning was just like the icing on the cake and throwing away the garbage and stuff. Anyway, he says, I think you popped out your disc. And my fear is it is the disc that they operated on because there's nothing more to take. They shaved everything they can. They leave just enough piece to hold the spinal cord up. There's nothing more to take. So then he would have to do something different. And I think that we still have a lot of options before we even get to the option of surgery. And he said, so I'm going to do an MRI just to confirm. I'm pretty sure you popped out a disc. Which one exactly? And I'm pretty sure it's the one that you did the surgery. So but I want to be 100% sure. So that's the purpose of the MRI. Then we can compare that to the last one. And he said, your surgery that was done 20 years ago, all the doctors concurred that it was a surgery that was great, that was done so great, and it was intact. But because that was so many years ago, we don't have those x-rays to compare, and it was done it was done in another city. And so, yeah, so I'm kind of losing my train of thought because my husband's about to come, and I don't want him to think that I'm overdoing it by trying to do this video. But yeah, so it was done in another city, and that doctor actually moved away to another state. But so he really can't say it's intact now. It wasn't the disc the last time he did the MRI, it was the nerves and the joints, which he still believes that I do have nerve and joint pain. I have a nerve and joint condition. that is still standing, that is still true. But now the discs are being involved. And he said, so I don't have nothing to compare to 20 years ago, and it wasn't done by any doctor here. It was done in another city. So unless we had those, then we can compare what was before and after. So we can compare to all the MRIs you've done here. And so that's what we're going to do. And he said, and I still think that if it is the disc, we can still management with physical therapy and with pain management, pain medication, will get you better and stronger. And I told him, I recognize I'm not going to be perfect. Once something is tainted, you're never the same again. You're never perfect. I just want to be healthier. I want to be better. I want to be stronger. That's it. Not perfect. Not like I used to be. And then I'm older too. That surgery was 20 years ago. So yeah, we're gonna do that. So I'm gonna wait for their call, and in the meantime, he's gonna see about physical therapy, and I'm gonna call them as well because he already gave them a referral, and he said the referral still stands, but he'll still check it and make sure if they need a new one, he'll be happy to send a new one. But the lady was supposed to call me back. She didn't. I had never talked to this specific lady before. I always talked to Kelly, which I've talked to forever. And so she couldn't find my paperwork. So I'm going to give him a call tomorrow because he said physical therapy is so important. And it is, because when I was going to physical therapy, it really made me stronger. It was really making a difference. So I know it works. But we had a lot more to go. So, yeah. So I'm going to call tomorrow and just see where that stands. My husband is on his way home with the medication. They gave me 3 medications, a Malaxicam, which I've taken before. I always take that one when I feel that the ibuprofen 800 is not working anymore. Then I'll stop taking that one and try Malaxicam for a couple of days, and usually that makes a difference. So I'm familiar with that one. Another one is Lyrica, which is a nerve pain. It's not an opiate, which I was concerned about. It's supposed to be really good. So we're going to try that. And then he did give me like a Norco, which is an opiate. And I said, I'm horribly, terribly scared. Sorry, I'm looking out for my husband. Afraid of opiates. I never want to take opiate medication. I've been offered them before, and I always reject them because I've done my research on them. I've seen the commercials. I've seen all the warnings. I said, I have an autistic son to raise. He needs me and I need him. And I can't be on drugs. I can't be addicted to drugs. I like to live a happy, healthy, normal life. So for even me and the rest of my family, I don't even want to risk it. And he goes, I'm going to control it, and you're only going to take it when you absolutely have unbearable pain. And I said, I'm so scared. But I said, okay, if you feel that it's gonna be absolutely safe and I only have to take it when I absolutely have to and only once, then I'll go ahead and take the chance. But I wasn't feeling good about it. So anyway, the pharmacist called me and he said, you don't have to if you don't want to. The doctor said that, but let's just have it on hand just in case you change your mind and you decide that it's just unbearable and you have to have it. And so the pharmacy called me because when it's a narcotic or an opiate, they have really big restrictions and they get questioned, which I'm so glad because of the opiate epidemic. They should be questioned. They have restrictions. I 100% support that. One of the restrictions was what was the exact reason that the doctor wanted it for me. So I told him what happened to me and what the doctor had said. And he said, okay, so I get it. So he reported that and then it was okay. And then he said, I noticed, he called me back again. He goes, I noticed on here you're allergic to morphine. And I'm like, yeah, I am. He goes, what happens? I'm like, my throat shuts down. I can't breathe. I turn pale. I'm going to pass out. And he goes, Norco and morphine are pretty much the same thing. They're like twins. They do the same thing. I said, okay, first of all, I didn't want it because it was an opiate. And I was just going to have it on hand, and I can almost assure you I was never going to take it. I would have to be dying, and I still can find other options. I just know me. And I said, and now that you said it's morphine, I'm allergic to morphine, it's similar to morphine, it's not worth the risk. I don't want to take the chance. And he goes, you're right. I totally agree with you, and you're thinking very smartly. He said, but I'll put it on hold. I said, well, I'll see my doctor again on the 29th. Put it on hold, and I'll have this conversation with them about that it's the same thing as morphine and I'm allergic to morphine. I don't think he realized it in the moment. And we'll discuss other things that can work just as well, but that it's not opiate and it's nothing similar to anything that I'm allergic to. He said, okay, that works perfectly. Jesus, somebody slammed the door. He said, so the others are ready. So he said, tell your husband I'm so sorry, because he was getting so upset because they kept making him wait 40 minutes. And then they said another 15 minutes and another 40 minutes. And he was like, this is insane to me. So he said, tell him we're sorry. Just that when it's a narcotic, it's just, they'll ask us one thing and then 40 minutes later we have to answer another thing, and we have to just, it's a lot of restrictions. So he said, but the others are ready. So I called my husband back, which is still there at the pharmacy. I'm like, the others are ready. And I told him the situation. He goes, okay, that's fine. I just want you to be okay. I'm not venting. I'm not like frustrated or upset at you. He said, I just know that you need me and I want to hurry up and get home to be with you and help you. And I want you to be okay. And I know you're in pain and you need this medication. So he said, that's my frustration. I hate when I'm told something and it's another thing and another thing. So he's on his way. So I'm going to take that. I just took my other medication that I have to take, which, like I said before, I'm going to do a video on our health issue, an update on our medical issues, which I've done videos on things that we've gone through health wise and medications and stuff. So, but we do have an update. My husband was diagnosed with a specific health issue, and so was I, and the medications that we're taking. So I want to update you guys on that and tell you what we've changed and how we're doing, and how it impacted us, and were we shocked, and anything that have to do with it, we'll update you on that. And now, of course, I'll update you on what's happening here. So I won't know anything until the 29th when I see him, and then whatever happens with physical therapy and however this medications. I'm feeling a tidbit better. I can barely walk. I need help walking. To turn sitting or laying, it's really hard. It's really painful. So I need help to do that. So I'm on the couch right now because I just got tired of being in the bed all night long and all day long because I just couldn't move. And so, yeah, so I'm going to sit here for a while, then maybe kind of rotate positions and watch some TV, some movies, videos, what have you. And then I'm going to see how I do with this medication. And I can feel that I'm a little bit better. I know it's the reassurance of the doctor. He just has this way of reassuring me. And so I tend to get a little bit better. And I'm sure the medication is going to work. And I already feel, even before the medication, I feel I can walk without help, because I just walked a couple of times just now and I'm limping, but I was able to do it without somebody holding me and helping me. So I'm like, oh my God, that's a little bit better. So that was hope. But the pain is still there. I'm feeling it right now. As I'm sitting, standing, and walking, all three hurt. All are the worst. Walking is probably the worst. But sitting is also, it hurts because I'm sitting right on that nerve, that joint, that disc, whatever the heck it is. It's all three happening. The nerve is damaged, the joints are damaged, but the epidural steroid injection still probably hasn't kicked in, and that's what's going to help the nerve and the joint. This pain now is the disc, so I'm sitting right on it, so it doesn't help. But I have to do something. I have to choose which one. Do I stand? Do I walk? Do I sit? So I'm going to just try to rotate positions and see how that goes. So I'm not in any one position too long. So I'm going to try that. And so I'll give you an update on that. But I really wanted to document this because in 2019, when I was bedridden, when this pain all began, I really regret, I had a couple of pics and maybe one video. But I really wish my daughter had documented no matter how much pain I was in, because I was suicidal. I was just done. I had been in the emergency room so many times. I couldn't bear the pain. Again, I was bedridden for 2 months. Almost didn't make it to my church wedding, but by the grace of God, I did. It was a great day. I didn't have any pain that day. I was so happy. Our dreams had come true. But leading up to that, it was very scary. So, yeah. So, and then the CBD, what saved me back then was the CBD. Then I got connected with this doctor and all his pain management help. Everything just came into play and helped me get back on my feet. But I'm still dealing with, different nerve and joints as, they're having pain. Here's my husband, so I'm going to go so he doesn't think I'm overworking myself. But I'll let you know as soon as there are any changes or anything happens or how the medication worked out or whatever, I'll let you know. Sorry. Hi,
Hi.
Dr. Young. How are you?
Good. How are you?
Good. Better than I was that day in your office.
What's that?
Better than that day I was in your office. So that's the
Yeah.
good
So
news.
I actually tried to give you a call, but yeah, I tried to follow up with you on your phone, and
You
yeah,
did?
it was from my. Yeah, I called you, but nobody picked up, so I didn't want to leave a message because
Oh.
if I would not say much, I just want to see how you're doing with your pain now. So
Oh. Okay. Well,
yeah.
it got a little bit better right away the next day. But
Okay.
of course, I was still scared, very
Yeah.
scared.
Yeah.
And I just started taking the medication. I started the prednisone, the
Yep.
Lyrica, the
Mhm.
what's the other one? Meloxicam.
Yep. Yep.
Meloxicam. I did not get the Norcal because the pharmacist called me, and he
Mhm.
said I have a concern. He said because on the computer you're allergic to morphine. This is morphine. This is like morphine. So I don't want to give it to you if you're allergic to morphine. And he asked me what happens when I take morphine, and I told him, he goes, I don't think so. And I said, okay, it's not worth the risk because I hate that my throat shuts down and I'm all bad with the morphine.
Yeah.
So we kind of
Yeah.
left that one alone. He's gonna put it on hold just in
Uh,
case we decide to go ahead with it. So he didn't put it back. He just put
sure.
it there
Sure.
waiting kind of on me and you having this appointment and what should
Yeah.
we do with it. So, and he gave me the rest of the stuff. So I finished the prednisone. I'm still doing the Lyrica and the Meloxicam. So I guess they're working because I haven't felt that pain. I feel in discomfort like when I clean
Yeah.
or when I walk too much or stand too
Right.
much or even sit too much. I get like a discomfort pain, kind of like
Right.
a, a throbbing pain, but not a horrible throbbing pain. It's just
Right.
kind of saying you need to stop.
Yeah. Yeah. Yeah.
This one position or this cleaning that you're doing is a little too much, so take a
Right.
break.
Right.
So it's
Right.
it's kind of like a warning sign from that's how I
Uh-huh.
take it, a warning sign that I've overdid it and I need to be careful. But
Yeah.
I haven't felt that pain that I went in your office that day. I haven't felt that
Yeah.
yet. Even though I'm scared because I was just washing my face when it happened. So now when I wash my face and brush my teeth, I'm panicking like,
Okay.
is this going to be the
Uh-huh.
moment? So,
Absolutely. No, it's you have every right to feel that way. And
yeah.
sometimes, unfortunately, our body is not. Everybody's very different,
Mhm.
and then it just could. For example, some people their skin may be so thin that they're more likely to be torn,
Mhm.
compared to other people's skin. So we all have a sort of a different genetic makeup, and
Mhm.
then for you to feel that kind of pain, it's okay. I mean, like you can get a little bit of PTSD from that area.
Yeah.
So at the same time, what you need to do, if my advice is do sort of a slow exercise and stretching.
Mm. Mhm.
If you ever talk to a very, very knowledgeable physical therapist,
Mhm.
because of your body type, because what happened is that the vulnerability of your lumbar disc, so certain type of exercise are actually maybe more appropriate for you compared to other types of exercises.
Okay.
So I think that's a key, because we still want to get the core strengthening, so this way your body, your spine is not going to take up too much toll. So if
Mhm.
you kind of think about what we discussed, right? I
Mhm.
mean, the discs are weak, right? So right now we really got to get the muscle, to get a little stronger, and at the same time we got to do the right type of stretching.
Mhm.
So your body is not going to be all stiffen up, because stiffen up, right, can
Yeah.
also causes more tolls on your disc. So that that's kind of like my suggestion. So some of the exercise, right, will be something we call that concentric exercises, and then closed chain kinetic exercises. These are some of the exercises a good physical therapist will understand. You know,
Okay.
more so than have you do it, more so than treat it like a military camp.
Yeah.
So that's my suggestions. Yeah, but now the key is that your inflammation. You put away your inflammation, so inflammation is starting to decrease. So you'll feel less and less painful.
Okay.
So I think that part of it will just it's like a fire. It's like a campground fire, and then you stifle the air. You put away the fire, and the fire will just kind of slowly
Yeah.
send down to the sparkles. Yeah.
Yeah. So I called physical therapy. At first, they couldn't find the paperwork, but what ended up happening is it was sent to Absorbatory instead of the health club. So I called Absorbatory and I had to leave a message. No one answered. So I had to leave a message. I'm waiting back to hear from them. But Kelly at the health club said, we couldn't find it because it was sent to Absorbatory. But Harold, who was working on my back and my shoulders, she said he used to come here and do the extra physical therapy, but now he's only going to be on Absorbatory. So maybe it's a good thing it went there, because I wanted to stay with him because he knew my situation and knew what to do with my back and my shoulders. So they said he had openings, but I haven't heard from them. So I'm waiting on that because I think that's going to help a lot.
Do you want me to send another orders to the health club?
Well, he's not going to be at the health club anymore.
Oh, so it's going to be an Absorbatory.
He's going to strictly be on Absorbatory now, which he loved being at the health club because he could use those machines that they don't have on Absorbatory. But I don't know what happened in this whole time. I haven't seen him, but they said he's going to be strictly at Absorbatory. So that's where he will be seeing me.
Do I need to do anything on my part?
I don't think so, because she said it was sitting there, unless you want to send another one just in case.
Okay.
So when I talked to them, they got a new fresh one.
Okay.
Because I told them the whole with the pandemic and us being in quarantine and thinking we had it, and we didn't end up having it, thank God. And then I had I had 2 surgical procedures with you. So I was trying to wait to make sure that I was okay to go back. Sure. And so, so I guess in the meantime, he went strictly to Absorbatory.
Okay. So go straight to Absorbatory.
Yeah, right? So that way they can have a fresh one and not have to look it up again. So... And I don't know, she asked me, was he going to be working on my back and my shoulders? But we've been so focused on the back that we haven't focused on the shoulders. So I don't know if you included that in the referral, the shoulders as well.
Do you want me to add that too?
Yeah, because that helps him to be able to do it and not feel like he's doing something without permission.
Okay. Let me see. And shoulder, and both sides?
Yeah, both sides. Remember, they were both damaged?
Yeah, I see. Yeah.
And I'm having a lot of pain in those shoulders, but my back has taken over. Yeah. So I'm kind of like, I'll think about you in a second. Let me get my back together. I can't do both because they'll make me go crazy.
Yeah. You got it. So I'll send that. I just sent that to Absorbatory Physical Therapy for back pain and shoulder pain.
Okay. And now I haven't heard from the MRI yet.
Yeah, it is still there. That was submitted on 21st, so it's still active. That means that nobody has canceled that yet. Typically, if it says inactive, that means that they already got the information they're processing. So far, it's just waiting. Yeah.
Okay. Yeah. So because I think that will give us a clearer picture of what's happening lately. Because when was the last time I did it? Wasn't too long ago, because I did it before the other.
But I was just more concerned that if you burst out another disc,
Yeah.
That's why. Yeah, I just.
Because that was a pretty sharp, severe pain. That felt like, okay, it's on the same side as the nerves and stuff, but something different happened.
Yeah, gotcha.
So I think the MRI is a good idea, because we'll exactly confirm what's really happening in there, because. My back is like you're going to have me forever. It's going to be like boom, 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 all these fireworks going off in different places. So like, what's happening now? Is it the nerve, the joint, what's the disc, what's happening? So
exactly, yeah. And that's why we want to really kind of get you in and treat it right away.
Yeah. So if the MRI shows that the disc popped out, what do we do for that?
Yeah, so we're going to look at the location. So if it's disc popped out, we're going to see the severity of the disc. Mm-hmm. We want to see the degree of that. and then I might even consult with my partner, Dr. Katsura. He is a spine surgeon. I might even like kind of check with him and see what we can do for you for on a more permanent basis.
Yeah.
Yeah.
Yeah,
So we'll just
because
wait
do
for
you
the MRI
is
first.
it you does surgery usually the only thing that helps a pop disc? So much has changed in the years.
Usually not really, yeah, pop this a lot of time we try not to do surgery if we don't have to.
Yeah.
So if we're able to, because keep in mind that sometimes you pop out the disc, right?
Mm-hmm.
And the disc, right, inflammation initially is painful, but you're pretty lucky because we got your pain down right away.
Right.
So what's going to happen? That disc is going to become scarred down, right?
Right.
So when the disc got scarred down, it's kind of like leather. It's a little more tough.
Mm-hmm.
So the future chances of popping up again it's probably not very high.
Okay.
Now, for some people, right, less fortunately, they may pop out the disc, but the disc may be so severe that's constantly, touching their pain nerves, causing inflammation. So they ultimately need to have like a discectomy.
Mm-hmm.
Discectomy means that you yank out, right, the disc that's protruded.
Mm-hmm.
So, but once you do that, the disadvantage is that once you take a disc decompression,
Mm-hmm.
now the remaining, right, has a little opening now, right?
Mm-hmm.
So that remaining area where the surgeon cut it will be weaker.
Yeah.
So there's a higher chance of popping out again next time.
Yeah.
So there's really two ways that you look at it, So that's why should we try all the conservative managing it, get it a little stronger,
Right.
or do you want to be too aggressively going and do surgery, but the patient may have the risk of re-injure themselves again?
Yeah, because I had the surgery 20 years ago, and here we are again.
Yeah.
So, yeah, I mean, 20 years is a good long time to not have a disc problem. So I'll take it, but who knew that it could happen again? I didn't know that back then.
Yeah.
I thought, oh, another disc, but that same thing. Which my understanding was that he shaved the whole disc and just left enough to hold the spine up. So I'm like, if that same disc is popping out, what's left?
Yeah.
There's not much to remove.
If not much to remove, the surgeon ends up having to do a fusion, which will be even a lot more major than just this. So a lot of things that we need to understand first to make the best decisions.
Yeah. So once I'm done with this Lyrica and this Meloxicam,
and Depo-Metro.
is there more refills? No refills on either one.
Yeah.
So what do I do when it's done? Do I just see how my back does without it?
Yeah, you can stop it and see how you're doing. If you want it, I'll be happy to refill it for you.
Okay.
My goal is hopefully try to kind of combat this as much as we can, and then so this way you can go on without having to depend on all the medication.
Yes, that's what I don't want. I don't want to depend on medication. I have this thing. I mean, I've never been addicted to anything. Never, thank God. Not food, not drugs, not nothing. Thank God. But I don't ever want to know what that life is like. Right. Like I said, I want to live a healthy, happy life. I have an autistic son that needs me. I can't afford to live that life. Right, so as much as I can do without being on medication, it's a great thing. Yeah. But I understand that sometimes I don't have a choice. I really have to take that medication to get things better and then go off of it.
Yeah.
And then I always have the ibuprofen 800, which is, I noticed that when the ibuprofen isn't working, and then I take, because I had Meloxicam before, it kind of works, but I only take it for a few days until the pain subsides. Then I go back to ibuprofen 800. Because I think Meloxicam is stronger, right? Yeah. Okay, so
it's not necessarily stronger, but Meloxicam is a different derivatives. It's all anti-inflammatory medication, but it's a sort of a different class.
Okay.
Not necessarily a stronger class, but it's just depends on how each individual metabolize that compound.
Yeah. So I just take that for a few days. Once the pain subsides, I stop it, and then I go back to just doing ibuprofen as needed. So that way I don't feel like I'm immune or I'm addicted or I'm dependent. I don't want to get to that point because I want to take it when I need it, and if I don't get dependent or immune to it, then when I need it, it'll work. That's how I see medication. Yeah, exactly. So I'm not, even my blood pressure medication, I know I have to take it. But I'm like, I don't want to take too many things, you know. But
Yeah.
I know that one I'm not going to run away from because my blood pressure
Right.
is still high. So
Yep.
he just raised up the dose now. It was at 5, then he raised it to 10, then he raised it to 20. So I think at this point, if it doesn't work, then we might try something different. But now with the shoulder, I have a question with my shoulder pain. Is this medication, does that also help for shoulder pain or?
Yeah, it does. Yeah, if it's anti-inflammatory medication, it also because it's carrying your body system, right? So it
Okay.
does distribute to every other part of your body.
Okay.
So you might also find some relief from the medication
Oh,
itself.
good, good. So it's like killing two birds with one stone.
Exactly.
Yes, I
Exactly.
love that part. Because if
Yeah.
I'm going to take it, may it all help everything. We're all good.
Yeah.
So, yeah. So, yeah, once it's done, once I'm done with it, I'll probably, if I don't have pain, I don't want worried about it. If I have pain still, then I'll let you know.
You
Maybe
got
we'll
it.
try again.